This video is for full waxing protocol, which means we're going to do the brow, the lip, underarms, bikini, full leg. So where we're going to start is as we have first arrived to work. So the first thing that we do when we get to work is we always wash our hands. So we go to the sink, we wet our hands, we find that coin-sized amount of liquid hand soap. We wash our hands down to our wrists, and we wash the back of our hands down to our wrists. We wash our fingers, we wash the back of our fingers. We wash our fingertips and our nails. We wash between our fingers and our thumbs. We wash our thumbs. We wash our wrists. We do all of that interlocking wash for a minimum of 20 to 30 seconds. And when we feel like we've done that, we're properly clean, we're gonna give it a thorough rinse under the water. Grab disposable paper towels or a clean towel, turn the faucet off with the towels, dry your hands completely, throw the towels in the trash, disposable paper towels in the trash. If it's a towel, it's now dirty that you used and it needs to go in a closed container until time for laundry. Then you're gonna find and grab your hand sanitizer, 70% ethyl alcohol, and you will finish your hand wash by sanitizing your hands. And once you've done that, you will be preparing your workspace. So we're just going to review that. And what you're going to want to do is disinfect your workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. You will check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You want to make sure that wax is turned on, obviously. You're going to gather clean supplies needed for the service, storing in a clean, closed container, and then you'll dispense products needed for the service. You're going to want to do everything you can do to prepare before your client arrives so that you are mindful of her schedule, your schedule. You want to stay as close to that as possible. So anything you can do ahead of time, you're going to do. You'll prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or you can remove product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We will also be making our bed because we are doing the full waxing, the legs, the bikini, every underarm, everything. So you would do the fitted sheet and the flat sheet with the blanket. You're going to be placing that rolled towel for comfort for underneath the head. You're going to the headband or hairnet or both. You will place an extra towel for the décolleté. You'll also make sure you have a drape because they'll be changing into that. Everything appropriate for the client. And so make sure you get all of that done. And I'm actually going to show you what I prepared before we go into client consultation, which is going to take a little bit of a longer time. So let me just show you my tray that is ready and set up. Of course, I've made the bed for the client. Because it says in there that you can use disposable table paper, but that's if we were just doing the brow and the lip. Because we're doing the full waxing protocol, then we need to make the bed. So on my tray, I have cotton rounds and I have 2x2s. I have 4 squares too, just as a backup. I have that pre-epilation product, powder, post-epilation, soothing gel, or this wax remove, and post-epilation. So we have also all different sizes of our wooden sticks for waxing and all different sizes of our strips for the waxing. We have tweezers and we have scissors in case we need to trim any more paper. Hopefully that's all done. Of course we have disposable gloves because when you wax, you always wear gloves. This is our wax for all intents and purposes for our video, and then I always have water here, or it could be deemed as like makeup remover, but we've got that there because we have our pre-epilation product right there. So everything on our tray is ready to go. Just be mindful that this wax is for video, but it's not like the real wax that we're going to be using. So tray is set up. So what we're going to do now, what you would do now, of course, is when your client comes, you would do that official client consultation, which is really critical, important. And we're going to talk about that. We're going to read a couple different things to be a little bit more thorough on that. So just note that when you approach your client, you're always going to be approaching your client with clean hands. Hands down, without a shadow of a doubt. Never with dirty hands. So I'm going to wash my hands again before the service starts, but just note that I am approaching my client for that client consult with clean hands. So we're going to greet our client and escort our client to the work area. We're going to assess the client's current style, determine the client's preferences, assess the client's needs, assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months and if the client's under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We're going to go into detail with all this for just a minute, just reading through this. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from any of the above contraindications, you can move forward with the procedure. But I'm going to go into a little bit more detail on that because with waxing, you have to be very, very careful with your contraindications. It's obviously they're going to be filling out a form, which is important. So just I'm going to give you a couple other notations because it's only some things you're going to be able to see on the face. But since we're doing things like underarms, bikini, legs, there's so much more that you have to think about, and you may not be able to see that when you're doing that initial client consultation. So if you're wondering, things like moles or maybe warts, they might not become apparent until you're working closely with that client, surveying the skin, maybe in that underarm area or beyond. So just note, you do not want to wax over those areas because you don't want to cause any irritation, nor do you want to spread a virus or bacteria to other areas. So let's go over even more skin conditions that might be contraindications. Varicose veins, very important, so you'll see those on the back of the leg when you're doing the waxing. Unusually pronounced moles or warts, cuts, abrasions, wounds, or open sores, active herpes, acne, skin diseases or disorders, a sunburn, rashes, cysts, or boils. So if any of those conditions are present, do not perform the waxing service. It is important to be aware that herpes in particular is highly contagious, and you should never perform a waxing service on a client who has an active outbreak. In addition, skin diseases that present visible irritation on the surface of the skin should never be waxed. You also have to think about following health conditions because they can cause a client to bruise, swell, or experience excessive pain during a waxing service. In addition, conditions such as diabetes impair the healing process. So if somebody has diabetes, you don't want to wax. Poor circulation, chemotherapy or radiation treatments, high blood pressure, a low pain threshold, or lupus. And lupus is an autoimmune disease in which the immune system is impaired or begins to fight against itself. So a lot of symptoms of that could be skin rashes, there's round red patches on the face. Needless to say, anybody with lupus should not be waxed. And then a lot of medications can cause the skin to become very thin or fragile and dehydrated. You do not wax while a client is on Accutane ever, or for about 3 months after the client ceases taking that medication. Instruct clients to avoid the use of Retin-A and alpha hydroxy acids, which we touched on that on the other form, for at least 48 hours prior to and after the surface because it can really thin that skin, make it flaky and dehydrated. So oral and topical medications or treatments that you absolutely do not want to wax with would be Accutane, which we just said. If they're taking antibiotics, no. Cortisone cream, no, because it's super thinning to the skin. Retin-A, Renova, alpha hydroxy, beta hydroxy acids, and if anybody has had a chemical peel on the face, you do not want to wax the brow or the lip. So you have to make sure that you really review that client consultation form before you can even start to prepare and get them ready for the waxing service. Thankfully, our client is free of any of those contraindications, so we are going to proceed. So we're going to give her some privacy because she does need to change. So because we're doing underarm, she's going to need to change into the drape so that we can get to her underarm. We're also going to be doing the leg and the bikini. So we've also left a pair of the disposable underwear, which you can do, which we'll touch on when we get to the bikini wax section. Or they can also wear a bathing suit bottom from home for your client. So you want to make sure that you have that. So they're going to change into that. They will be getting under the sheets and the blanket so they're warm and comfortable. So you give them that privacy to disrobe. The most important thing is their comfort, and you're going to check in with them often. So our client has gotten into the bed, so she's comfortable. So what we're going to do is make her even more comfortable. So let me just turn this down a little bit so you can see. Okay, so we have that towel on the top of the bed here so that no wax will get there on the sheets. And then we've got our rolled towel here that I'm going to place under her neck just for a little bit more comfort. And then I am going to place a hairnet on her so that I can keep the hair out of the way of the brows, etc. So we're going to put that on. And I also have an additional towel here that I'm going to lay over her décolleté. Just, we don't want any kind of wax to fall anywhere that might on her clothing or her person. So we're going to make sure that's nice and covered. And that part is good. So in order for me to proceed with the waxing service at this point, I have to wash my hands. So I'm going to go ahead and do that. First thing I'm going to do is wet my hands at the sink, get that coin size liquid hand soap. I'm going to wash my hands down to the wrist. On these, I wet my hands and then I get that coin size hand soap and then I rub my palms together down to the wrist and then I wash the back of my hands down to the wrist. I'm going to wash my fingers and I'm going to wash the backs of my fingers. I'm going to wash between my fingers and I'm going to wash between my fingers and my thumbs. I'm going to wash my fingertips and nails, of course. I'm going to wash my thumbs. I'm going to wash my wrists. And I'm going to do all of this good proper wash for a minimum of 20 to 30 seconds, and then I'm going to give everything a really good wash and rinse underneath the water once I finish that. So I feel like everything is really, really rinsed off good. I'm going to grab some disposable paper towels or a clean towel to turn the faucet off, dry off my hands. If I use paper towels, they go in the trash. If it's a towel, it's dirty now and it just goes into a closed container with a lid until it's time for laundry. I find that hand sanitizer, 70% ethyl alcohol, and I'm going to sanitize my hands. And one thing to note here is that you want to make sure you get everything good and dry because you're going to put gloves on because you're never, ever, ever going to do any waxing without a gloved hand. So we are going to make sure we're dry and then we're going to put on our disposable gloves. And so what I'm going to do first and foremost is I am going to assess the direction of the hair growth for her brows. And that's critical because you apply wax in the direction of the hair growth. So I'm going to look at her brows and see, and I can see that she's got a fairly thick brow and a lot of area that we talked about style, of course, in the beginning. A lot of an area that she wants to remove, but some of it we're going to do with tweezer because we can control the shape a little bit better. So I see I've got a couple directions here with the brow and then a little bit in the center of the brow that's going growing down. So that's no big deal. We're going to take care of that. So the first thing we're going to do is we are going to remove any makeup or oils that she may have in this brow area. And of course, we're always going to avoid the eye area, and I'm not going to get anything in the eye. And I'm working in the direction of that hair growth, and then I'm going to go back against it too. I just really want to make sure that I'm getting everything clean. If there's sunscreen or makeup, etc., I want to make sure that I remove all of that product. And any trace of any kind of moisture or anything around that brow area, which could be from makeup, like I said, moisturizer, SPF, all just oil on the face, sebum from her skin. Okay, and then what we're going to do next, of course, is give it a really good drying step. We're going to take a little powder and make sure that it's super, super dry, because you never want to wax on damp skin. So we're doing a couple things here by the pre-epilation step and this powder step. We are not only preparing the skin for the waxing, we are protecting it. This way the hair will come off instead of the skin. So everything is nice and matted out. And now we're going to go into the wax and actually test the temperature of the wax. And what we're going to do is I'm actually going to test it on myself first. I would never test it on a client. So I'm going to get a little bit of the wax from my wax pot, and I am going to take it into my wrist at a 45-degree angle, and then I'm going to spread it out, making sure the temperature feels great to me. And so what I'm going to do now is just remove that wax, holding that skin tight and taking it off. And it felt great. It wasn't too hot, so I know that I'm okay to go in here for my client and get started on her brows. So I'm going to start on this side because we've prepped everything beautifully. I'm going to get a little bit of wax scraping off the sides and the back, and then I'm going to take it into her brow at a 45-degree angle, and I'm going to let that wax fall down, and then I'm going to apply it in the direction of the hair growth. So once I get towards this outer bit here, I'm going to start turning my wax down a little bit because the hair grows up and out and then down. And then I'm going to take my wax remove strip here. I'm going to apply it to this area, a little thinner piece. And I'm going to press so that that wax strip sticks really nicely. And then I'm going to hold the skin nice and taut, and I'm going to remove it against the grain of the hair growth. And then I'm going to press to avoid that, or to relieve a little bit of that stinging sensation. And now I'm going to take another strip, and I'm going to go where I place the wax kind of down, where that hair is growing down, and I'm just pressing in. And then I'm going to hold the skin nice and tight, and I'm going to remove it in the opposite direction of the hair growth, and then press so I can relieve some of that pressure. So that was pretty good. We're going to do a little bit more of a control with tweezing once we're done. Now we're going to go to the top of the brow and repeat this process on this right eyebrow. 45-degree angle, let that wax come down, and then I'm going to spread it out in the direction of the hair growth. And I'm trying to stay as close to, when I remove it, hold the skin taut, trying to stay as close to the skin as possible when I remove it. Instead of going up, I'm going along, like forward, close to that skin. Hold the skin taut, and then pressing in to remove a little bit of that stinging. So that looks, excuse me, good, really, really good. So what I'm going to do is I am going to go ahead and do the other brow, and then we will do all of our tweezing and everything together. So we are going to take our tray over here so that we can remove everything with the wax first, and then we're going to get in there and really finish our shape up with the tweezing process. Hold the skin nice and taut, press. Just really trying to be conscientious and at the same time work with focus, because I want to move forward quickly so we don't have to wax. She's getting a lot of waxing done, and I don't want her to have to be here for a million hours. I'm just moving as quickly as I can, being mindful of being, the work, obviously, wanting to do a good job, but trying to not be slow. And the faster I move for her, the less painful it is. Because she is getting so much waxing done, I want it to move as quickly as possible. So that looks great. Of course, we got to do the tweezing too. Now we're going to go to that center of the brow where the hair is growing downward. So we're applying our wax in the direction of the hair growth. Little thin layer. And then we're going to remove it in the opposite direction, which is, a little bit hard when you're in the center here, but it's not too bad. You're just going to hold the skin tight on the either sides of the eyebrow before you remove your little strip. Okay, so we need to use that post-wax remove to get any of this excess residue off, and then we can go back in here and tweeze what we need to, because we're going to do a little bit better at shaping her arch with the tweezers. She's very specific about her brow shape, as she should be, because it's so important to the eye. So what we're going to do is really get in there now that we've removed any residue from the wax and control that shape nicely. So I'm going to get my cotton round and my tweezers, and I'm just going to work a little bit on that shape. And with your tweezers also, you will remove within the direction of the hair growth. And I just work slowly because I just have like a couple little rows here of little tinies that I'm doing to get that arch really nice. Couple a little bit right here. And then she has a couple on the inside of her nose that it's hard to get in there. And same with this side. I want to really take my time to get those little stray hairs just to elevate that arch a little bit without it being too sharp, just a natural. But you can be a little bit more precise with your tweezers. So on this side I have to pull that way, on this side I have to pull that way within certain areas right now, or I would be pulling down slightly as I remove any hair. There's some also on this little inside of the nose. But that did really nicely in the middle. So that is a really, really pretty brow. And then we're going to give her that nice, beautiful, smooth out post-epilation. Just calm and soothe her a little bit, which she's excited about, before we move on to the lip area. Just give her that as we move throughout the waxing from top to bottom for her. We are just giving her a little calm and soothe as we complete each area. Now I'm going to move on to the lip, and if it was a different client, I would be going through every procedure, including the temperature check with the wax on myself. But because it's the same client, I can just go right into that like skin analysis or hair growth analysis and then move into the waxing without stopping instead of having to test it on myself. So what I'm going to do first is just look at the pattern of hair growth, and I see in the center we've got some coming down. We've got this outward growth on the top of the lip, and as you get to the outer corners of the mouth, I see that it's kind of growing down again. So we've got a little bit of an application to do here with the wax. And I'm going to wax everything. I'm going to move through this as quickly as I can. This area tends to be a little bit more sensitive, so I want to apply the wax, a nice good thin layer spread evenly, and remove as quickly as I can. As we get over here to the corner, I'm going to bring some down. Because it's definitely in our culture for women not the most fashionable to have a mustache. So I want to get in and out for her as quickly as possible. I'm going to make sure I really hold that skin taut and remove it, and I'm going as close as I can to that lip. And then I'm going to go down with this one. Same thing, hold the skin tight. Nice, just looks like there's a couple I'm going to have to tweeze, but not much. Let's get to the other side, knock that side out as quickly as we can. Not leaving her here too long. It doesn't feel great to have your lip waxed. I've had it done many a time. The things that we go through for beauty. Hold the skin taut. We're always removing against the direction of the hair growth. And we've got this one little area in the center here that we need to apply some wax to. It's kind of like closer to the nostrils and center. And it kind of dips down through there, so you may want to have the client put their tongue under that area and kind of flatten it out for you so you can get to that hair a little bit easier. This one is hard to pull close to the skin. You just got to do the best that you can with it, because you will have to pull up slightly. Hold the skin nice and tight and remove. And then what I'm going to do quickly now is just give her that little bit of remove, residue, wax residue remove, and then we'll do tweezing. Also going to be quick because I don't want her to be in any pain any longer than she has to be. So I've got my cotton round and I've got my tweezers, and I'm just going to go in here really quickly. There's not really a lot to take off, just a little bit by the nose, which can be painful. Everything else, just a little bit here and there. Okay, that looks great. So remember that, soothe her now so she can just cool it down. Can be no fun right there. Hopefully that feels better for her. And like I said, just keeping in mind that that can be a tough area and you just want to process through because you have so much more to do. So you've done that face part, and now we're going to move forward to the underarms. So I'm just going to pull this, make sure she's comfortable. Take this towel down a little bit, and then I would have her, we're going to go through that underarm part, I'm going to read it first, have her get sit up and situated for what I'm about to do. So let's kind of review that. Once again, we have the same client. So we're clean, we've got our gloves on, we don't have to check the temperature again, but we are going to make sure that she's warm and comfortable, and then we're going to cover her torso, which we have, and then we're going to ask her to get one of her arms and take that out from under the cover and put the hand behind her head so that her elbow is wide as so. So you want to make sure that she doesn't just take it and put it right here. So her hand's behind her head and her elbow is up so that you can get to her underarm. You'll be working up at the head. And the very first thing that we do, just like we did with her brow and her lip, is we analyze the direction of the hair growth carefully. So it's very common for the hair under the arms to grow in several different directions. So you're always going to apply wax to each section in the direction of the growth and remove each section in the opposite direction. So we're going to apply that, she's here, pre-wax solution to remove all residue of body lotion and deodorant, and then lightly dust that area with the powder to remove any last trace of oil or moisture. We're going to get our wax by dipping a spatula into the wax pot, wiping the side, the back, and the tip until a thin coat of wax remains on one side. Holding the spatula firmly at a 45-degree angle, we'll place the tip on the skin, let the wax run down the spatula, then spread the wax as thinly as possible over the desired area, applying it in the direction of the hair growth, and of course we throw that spatula away. Then we're going to apply the removal strip. So something for this area is going to be a lot larger. Making sure that we have a narrow strip of fabric and then fold over an edge that you'll use as the grip. You're going to smooth the remaining portion over the wax, pressing and rubbing the strip a few times. You'll pull the skin taut with one hand, and with the other hand, remove the strip quickly in the opposite direction of the hair growth, trying not to pull the fabric straight up, instead pulling it as close to the skin as possible. Then we'll apply pressure to the area immediately to help to reduce the momentary stinging sensation. Be sure to check the underarm and strip to see that the wax and hair have been successfully removed. Then you'll repeat the procedure on a new area, work quickly in this manner throughout the underarm, and then repeat on the other underarm. So we'll review what we would do on the other underarm so that you can understand what is happening. So we're going to have them put their hand behind the head, elbow is up nice and high, and you'll analyze the direction of the hair growth first and foremost. Then you're going to take that pre-epilation product and you're going to take it all over that underarm to remove any oil, deodorant, moisture whatsoever, following with a powder in that whole area to make sure that you've absorbed any last trace of oil. Then you'll get your spatula, you'll place it into your wax pot, and you're going to scrape off the edges in the back so that it's just a thin layer on the spatula, and then you'll apply that spatula directly to the underarm in that area that you want. Let the wax run down the spatula, then the thin application of the wax in the direction of the hair growth, and you're going to get that strip, and you're going to place it on the wax. Make sure you have a nice little lip so that you can remove it, and you're going to press that into the wax a couple times so it's nice and connected. Then you'll hold the skin taut, and then you'll get that little edge, and you're going to remove it as close as you can in the underarm in the opposite direction of the hair growth. Once you remove it, immediately pressing in to relieve any stinging sensation. Obviously, you're going to be tossing all those things. Check your underarm, check your strip, make sure the hair came off, and then you're going to work around in the different directions of hair growth and remove in the opposite direction of hair growth. Once all of the underarm hair has been removed with wax, what you're going to do is use that wax remove product, okay, to remove any residue of the wax. And then you're going to remove any stray hairs on the underarm with tweezers. So make sure that you're being a perfectionist about it. You'll double check that there's no hairs in the underarm. And then once you're done, you get to apply that soothing gel to the underarm area and show the client the results. So they know that you've gotten all the hair, that it looks really, really good. It's also a painful area to wax, which some can be. So make sure that you're working quickly. I do want to mention one thing. It is not uncommon for newer underarm clients to bleed slightly from the follicle, since the hair in the underarm is often very coarse and dense. Bleeding will cease with continued waxing as the hair thins and becomes sparse, which is another reason it's important and necessary to wear gloves while waxing. So just let them know if that happens that it's not uncommon, and that it will, as they continue to get their underarms waxed, they won't have that same response because the hair is going to thin out. And so now you can cover up the torso, and we're going to move down to the bikini area, and we're going to review the protocol there. We're going to be doing the classic bikini wax. And our hands are washed, sanitized, of course, because it's the same client and we have our gloves on. You're going to drape a client and you're going to offer them, you did initially when they first were changing for their waxing, a pair of disposable undergarments, or you can instruct the clients at time of making the appointment to wear an old bathing suit or undergarment. Instruct your client to remove clothing from the waist down, settle them onto the facial bed lying on their back, and if she wears her own bathing suit, you can tuck some tissue inside them around the leg holes to protect the fabric from the wax. However, our client decided to use those disposable undergarments that we will throw away, so we don't have to worry about that part. So we're going to talk about preparing the skin. So your client is going to be placing one leg outside of the bedding, the sheet and the blanket, and she's going to place the bottom of her foot against the opposite knee. So it will look like this. If my arms were her legs, she's going to take one leg out and place it against the foot against a knee. So the knee is bent to the side. And then you're going to tuck in the sheet all the way along this leg, and she's going to put her foot right there. So everything is private. The only thing that's out right now is that side of her leg, and you're going to make sure she's her comfort level, and you're going to be able to address and assess direction of the hair growth. So that's when you're going to start right there. Once she's got her knee out and her foot on her knee, you're going to be able to assess the direction of hair growth carefully. And if hair grows in several directions, you're going to, of course, apply the wax to each section in the direction of the growth and remove each section in the opposite direction. So on this side, you will apply antiseptic preparation, or that pre-wax solution, I should say, to remove all residue of body lotion, and then lightly dust the area with the powder, and that will remove any last trace of oil or moisture. Then you'll obtain your wax by dipping a narrow spatula into the wax pot. Wipe the side, back, and tip until a thin coat of wax remains on one side. You'll apply the wax beginning on the upper thigh. So if I'm here, you're going to start at the upper part of my bikini line, that upper thigh, and you're going to apply it there. Hold the spatula firmly at a 45-degree angle, place the tip on the skin, let the wax run down the spatula, then spread the wax as thinly as possible over the desired area. Remember to apply the wax in the direction of the hair growth. Discard the spatula. You will remove wax and hair by applying a removal strip. Take a narrow strip of fabric, fold over an edge that you'll use as a grip. Smooth the remaining portion over the wax, pressing and rubbing the strip a few times. Pull the skin taut with one hand, and with the other hand, remove the strip quickly in the opposite direction of the hair growth, trying not to pull the fabric straight up, instead pulling it as close to the skin as possible. Apply pressure to the waxed area immediately to help reduce the momentary stinging sensation. Then you're going to repeat the procedure on a new area, working inward toward the panty line. Then wax along the panty line, drawing the knee up slightly as the work progresses. You can ask the client to help by holding the skin taut with her hand. Work around and along the panty line toward the back. Switch the leg positions when the entire area is clean, and repeat on the other side. So her foot starts on the opposite knee, then she's going to have to lift the knee up as you're working from that top of the thigh into the bikini line and down to the back. That leg's going to go up so that you can do that, protecting her, always tucked in her privacy, tucked in with that blanket, but just getting into that bikini line. And she can help you hold the skin tight as you work in. Then you're going to do the other side. So you're just going to switch. You're going to let that leg go under the blanket, tuck in completely as she takes the other leg out and then places her foot on the knee. Once again, assessing the hair growth, going through that growth pattern. Then you're doing that pre-epilation product and then powder to remove any residue of lotion or oil whatsoever. Then you'll be able to start your waxing, and you'll work out and in just like you did, and then all the way down the bikini line on the other side. Once you've done the other side completely, you'll remove any excess wax with oil or other wax removal preparation, and then check the area, remove any stray hairs with tweezers, apply that soothing gel or medicated lotion to the entire waxed area, showing the client the results. So once again, noting, if it is not uncommon for newer bikini wax clients to slightly bleed from the follicle since the hair is coarse and dense. Bleeding will cease with continued waxing as the hair thins and becomes more sparse. It is important and necessary to wear protective gloves while performing waxing services on the bikini and underarm areas, since exposure to blood is possible. So just keep that in the back of your mind so that you can tell your client if that does happen. It is common. Don't worry about it. Everything's going to be okay. And as they come in for more waxing on a regular basis, things will get better and better. And that won't continue to happen. So let's talk about moving forward. So now the client gets to stay covered up because we're going to work on waxing the legs. And she wants the full leg wax. So it's top of the thighs all the way down to the ankles, to the feet. And then as she turns over, once again, it will be top of the back of the leg all the way down to the ankle, to the foot. So let's review. She's on her back, so you're going to have her stay on her back to start. If she just came in for leg waxing, she may want to start face down, and you can start on the back of the leg and work your way down. But since she's having all of this done, let's keep her on her back, and we'll turn her over in a minute. So if it was a half leg wax, it would be from top of the knee to the ankles, but it is a full leg wax from the top of the thigh to the ankles, just so you know. And we're going to talk about a few things before we get started with full leg wax. We are starting on the upper thigh, so you will obviously drape accordingly. So you will be able to move the blanket and sheet so where you can see the upper thigh. Everything else of her right now is covered and comfortable, so you just want to check in with her comfort level. And the first thing that you're going to do, of course, is assess the direction of the hair growth. She does have on those disposable undergarments, so you don't have to worry about that. She's already in the right appropriate outfit for this, so you don't have to make any changes. She's removed the clothing from the waist down and of course had already had the disposable undergarments on. So you want to make sure that you have completely exposed the skin that you need to, but everything else is nice and covered and comfortable. So you're going to assess the direction of the hair growth carefully, and if hair grows in several directions, you're always going to apply the wax to each section in the direction of the hair growth, removing each section in the opposite direction. Of course, we're starting on the top of the thighs, and I want to make a couple notes about that. Skin on the upper thighs tends to be loose, so extra care must be taken to keep the skin taut while removing fabric strips. So be cautious to never wax with one strip over the inner bone located at the top of the leg to avoid bruising when the strip is pulled. You'll always apply the wax in two sections to this area. So noting that, you can go ahead and apply your pre-wax solution and remove all residue of body lotion to the top of the thighs. Or if you want to start on one leg, but I would go ahead and do it on the, if If you're going to do the tops, go ahead and do it on both sides because they're out. Unless you're working at on one leg at a time. And then you can lightly dust the area with cornstarch or powder. And then that will remove any last trace of oil or moisture. Now you're going to obtain wax. For the legs, you want a wide spatula, something much larger than something teensy. You will begin at the top of the thigh. Hold the spatula firmly at 45-degree angle. Place the tip on the skin and let the wax run down the spatula. Spread the wax as thinly as possible over the desired area. Remember to apply the wax in the direction of the hair growth. Discard the spatula. Then you'll apply that removal strip. Take a wide strip of fabric, fold over the edge that you will use as a grip. Smooth the remaining portion over the wax. Press and rub that strip a few times. Pull the skin taut. Remember, you have to be very careful on the top of the thighs. With one hand and the other hand, remove the strip quickly in the opposite direction of the hair growth. Try not to pull the fabric straight up. Instead, pull it as close to the skin as possible. Then apply pressure to the area immediately to help reduce the momentary stinging sensation. Repeat the procedure on a new area. Continue waxing across the bottom of each leg. Turn the client onto the back and, repeat the procedure on the new area, which is the other top of the thigh, the other leg. Then you're going to work down toward the bottom of the legs, going down to towards the feet. You have to note that you need to bend the legs slightly to wax the kneecap. Otherwise, that skin's loose, and then when it's straight, and then when you bend the knee, it's tight, so you'd be able to do that. Once you finish that, you're going to remove any excess wax or oil with that wax remove step. Remove any stray hairs with tweezers, and then you would apply that soothing gel or medicated lotion to the entire waxed area, showing the client the results. So you've got to do the front of the legs all the way down. You've got to turn them over, and you've got to do the back of the leg all the way down. It's going to take some time, but you want to be mindful of your time and keep on moving. Just steady Eddie, steady Eddie. So make sure you're doing all the proper procedures for all of the leg on both sides of the leg, and making sure that you're noting the direction of the hair growth is the most important thing. So, some people are concerned with ingrown hairs. We're going to touch on this before we finish with our client. That is a hair that grows from underneath into the surrounding tissue rather than going through the follicle out to the surface of the skin, resulting in a bump or inflammation. And ingrown hair can also occur when the hair curls and continues growing back into the skin. So, causes of this, sometimes it's just predisposition. Many clients will be prone to ingrown hairs simply because of the condition of the stratum corneum and the coarseness of their hair. So obviously your hair removal techniques are really important so that you don't break the hair off as opposed to removing it by the root, because that can lead to it. So we're going to always prep the skin and remove all traces of makeup, lotion, sweat, or other residue to gain proper adherence of the wax to the hair. We're going to remove that wax strip by pulling parallel close to the skin, not up, and quickly and smoothly as possible. We're going to guide our client to exfoliate on a regular basis using a loofah or similar sponge while in the shower. That will help. And then we can also recommend an alpha hydroxy acid or glycolic acid or cream 8 to 12 hours after treatment. Has to be 8 to 12 hours, so not right after treatment, to promote cellular exfoliation at the top of the follicle. We want to condition them or recommend to them to perform waxing on a regular basis because it creates finer, softer regrowth of the hair, so that will help eliminate some of those ingrown hairs. And then, of course, we're going to recommend any retail products that are designed to keep the skin soft, as well as reduce the formation of ingrown hair. So we can do all of those things to help them out to have the maximum benefits of their waxing appointments. So obviously, we want to make sure that the client understands all of these things when you perform the waxing services. So thankfully, she has allowed us to move through the process as quickly and professionally as we can, and we've checked in with her comfort level. She feels really, really good. We've done everything from the brow, the lip, the underarm, the bikini, all the way down to that full leg front and back. And we've shown her all along the way, and she's been really happy. So let's talk about how we would close this sale or service, and then get her rebooked, and then what you need to do to get ready for your next client. So super important, we're going to give her privacy so that she can get dressed. So she's going to toss those disposable underwears, those one time that we've given her for the waxing service. And then she'll take the drape off, put her clothes on, and meet you back at that client waiting area so that you allow her to do that with her discretion. We're going to go over any maintenance and aftercare, and obviously suggest and recommend and get her rebooked to make sure that she stays on this waxing timeline so that that hair just gets softer, finer, and easier for her to deal with. And then we'll get her checked out and on her way. So we've done all of that. She's super happy. And then you've got to go back and get your room prepared because you have another client coming in for waxing. So you are going to discard any single-use items that have not been discarded at this point. And some, like we were moving around with our tray, we weren't able to discard everything immediately because the trash was not right there. So now we've done all that. Perfect. You're going to obviously take off your disposable gloves. You probably did that before you even walked her out, and throw them away, which is so important. You're going to find those dirty implements that you might have used, like the tweezers, scissors, etc., and you're going to put them in a closed container labeled to be disinfected. You will get the drape, the sheets, the towels, all the things from her bedding, and you'll place it in a container with a lid until it's time to do the laundry. And then you will need to clean and disinfect your work areas. So you're going to identify a proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage. Wipe down your workstation and area with cleaning solution to remove debris. You're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting, which means you're going to put gloves back on, a new pair of disposable gloves. You're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment, store it in a clean area separate from other implements, and then you're going to wash your hands. You will go to the sink, wet your hands, find that liquid hand soap, coin-sized amount, and you're going to wash your hands down to your wrist, and you're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the back of your fingers. You're going to wash between your fingers, and you're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrists. You're going to wash those fingertips and nails. You're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And when you have finalized that wash, you can thoroughly rinse underneath the water. When you feel like you've gotten a good and proper rinse, you're going to find some disposable paper towels or towel, grab it, turn the faucet off with a towel, dry your hands off. The towels are going to go into the trash, and the paper towels are going to go into the trash. That towel is now dirty if you used a towel, and you can put it in with other soiled linen in that closed container until time of laundry. Then find your hand sanitizer, 70% ethyl alcohol, and you'll go ahead and sanitize those hands just as you would washing your hands, and then you'll be able to set up and prepare for your next client who is getting ready to come for a very similar waxing service. So the word's getting out that you can really wax, and now you're booked up and you've got a lot of appointments. So this concludes your full wax evaluation from brow, lip, underarm, bikini, and full leg.